title of my presentation is Together in Advancing the Gospel. If you take home something today, I want you to take the word together. And I want to give you a context. The context is, I come from Nigeria originally, where our population is about 190 million. 90 million of that population is from the north of Nigeria. And that's where I come from. In that region, we have a hospital, the Jingiri Adventist Hospital. That was where I was born some few decades ago. In that community, I will call it the Jerusalem of the Adventist Church in Nigeria, in the north. Because that is where the church started, and that is where we have our population densely. It is a Seventh-day Adventist community, but 90% of the patients are Fulanese or Muslims. Here are they. Our hospital treats them physically and also with the animals, because we have a vet clinic there. They belong to what we call the 1040 window. That is where strategically the General Conference is facing, because it's focusing, because it is where we have the greatest population. Nigeria is in that region. China is in that region. India is in that region. So that is the population of the world. So when Pastor Mafosa was saying that budgets are going to be moved, I'm told from the rumor that the budgets are going to move to the 1040 window, because that is where the needs are greatest. And Nigeria, the northern Nigeria, is one of them. The Fulanese are the most difficult tribe to reach out to. There are about 30 million of them across West Africa, and about 7 million of them are in Nigeria. Here they are, beautiful people. Last year we were there with our Loma Linda team, and we treated about 2,000 of their animals, reaching out to the most difficult tribe we have in the north. Like I said, they are almost about 90% or 80% of our patients. And to God be the glory, because of the ministry of that hospital, we have produced about 3 pastors serving in the region of the north. This is my point. We have emphasized this over and over during the week, that the right arm of the gospel is the health ministry. And at the gate is what? Our health institutions. It's an integral part of our mission. And of course, Adventist Health International supports the mission of the Seventh Adventist Church. What is AHI? What we do is that we partner with unions and of course the division. That's why we're here in the Southern African Division. We partner in the area of partnership, collaborations, education, and leadership. Our main area of focus is capacity development. Some of you have attended our conferences and also our workshop. We also train individual professionals in hospitals and clinics. Effective operation. We do a lot of quality management. And of course, we do all this because we want to grow in a sustainable manner. We have about 40 hospitals and clinics across the globe. A lot of them are here in the south, 14 countries, and 5 divisions. Our structure is that the continuity of the church, the 5 divisions and Loma Linda and some other partners form our constituency. And of course, we have a board that oversees us. In fact, Elder Cooper was once upon a time our board chair. He just retired some few years ago. Dr. Landless is a vice president of our institution, of our organization. And of course, we have what we call the ADCOM that sits every Friday in Loma Linda to oversee the operation of the wall. And of course, we have individual countries that are part and parcel of Adventist Health International. How do you partner with us? we start with the division. So for us to be here, we first of all sign an MOU with the division here. And of course, our unions or the unions here have a partnership with us. That goes through our outcome, and from our outcome, it goes through our board, and from the board, you are part of us. The goal also is that we are looking at opportunities in the cities. You know, the church now is looking at mission to the cities. AHI is not exempted because we believe that is where the population is. That is where the resources are. And that is where, of course, we have the most talented Africans. So 90% or 80% or 90% of our institutions are all in the villages. As an African, you give me all the training. Psychologically, I want to be where? I want to be in the city. So we tend to wonder why our young people are not working for us. Sometimes we need to look at the psychology of where they are. And it's because they're out in our institutions are out in the country. So we're trying to start our hospitals and clinics also in the cities where the resources are. Because we believe when we have a system, we can also have a strong correlation with growth. You know, when you have things done together, you tend to be stronger. Somebody put it together that together everyone achieves more. That's how we team together. If you pull together, you work together and stronger. What is the framework of our vision? Our vision is when we start to work with countries, our vision is to create healthcare system because we believe it is best practice. Our institutions now in our countries are running on their own on a silo. Think of putting them together, stronger, and then you are going to have a very strong service delivery. And once you have that, then you can address some of the problems we're having in our communities that has to do with health and healthcare. And once that is done, of course, you can respond to epidemic, Ebola, whatever you call it. And of course, you can also do evangelism. We are expanding in the region of the South. We have been having what we call mega expo, health expos. So every year we pick a country, and Loma Linda University will recruit healthcare professionals from the US and from Loma Linda and go to that country. Last year we were in Nigeria and we saw about 10,000 patients in 10 days. This year we were in Angola, even though we didn't do a lot of clinical, but we were able to engage with the government. Next year, we are going to Mozambique. And we are taking about 65 healthcare professionals from the US. But I want to invite you, because I see a lot of healthcare professionals here that are here and out. Please, as an African, I won't want to bring international healthcare volunteers from the US and don't have my African colleagues participating. So I want to see a lot of our people from here participate in this, because this is a new area. Mozambique does not have a single hospital or clinic that we can boast of. This is to trigger the discussion to start that. So we're going to be having Health Expo or healthcare in 3 centers next year. In conclusion, the goal is to win souls and to prepare souls for the kingdom. I want to leave you with a formula that I've created just this week. That when you want to get to the heart of the gospel, you start with healthcare, you combine it with health education, and what happens? Health ministry. And I want to say AHI is together in this. Thank you very much.